Ma'am, we are now live. We can start.
We can. So very good evening on Her World India. I welcome you all, but this is not the best time actually that we are starting this series. And of course, we have been holding these conversations for a very long time. We started last year. But today, when I talk to you, ladies and gentlemen, brothers and sisters, we are also paying tributes to one of us, a journalist who we have lost, Rohit Sardana. The news came in this afternoon, and we really all feel shocked and heartbroken. He made his mark as an anchor, as a journalist on Aaj Tak News channel. And today, of course, we know that a lot of people are leaving us. We are losing, in many ways, this battle against COVID-19. Here is Rohit Sardana, and we are paying tribute to him on Her World India talk show series. Many of us, if you look at the numbers, more than 100 journalists and friends that we've lost. But Rohit, of course, has been here to many of us, and we really, offer our condolences to his family as well. Her World India talk show series has been taking up social issues of contemporary importance. We have partnered with Policy Center and General Lab Miranda House, and we've tried to cover many issues which concern us all. And this is just one of the editions on the talk show series. But in this second wave of COVID-19, we felt that we need to really talk about some urgent issues. And that's why we have chosen this panel here. And I'm very thankful to each one of you who's joined here, the panel of speakers who've joined here as eminent guests, but also all those participants who are joining us and who are watching us. I would urge you to connect with us because we are talking about issues that concern you and us. It's all around us. And I think it's very pertinent that we need to talk about issues. And that's why we've today kept the topic tackling second wave of COVID-19. Last year, we of course faced the havoc, but this time we are seeing some very, as they say, unseen forces, but also forces that we are grappling with in a very urgent manner. So let me introduce the panel of speakers here. Mr. Yashovardhan Azad needs not much introduction, somebody who has held many important portfolios, a former IPS police officer, but also somebody who's looked at securities, been information commissioner and director at many important positions. I welcome you, sir, Mr. Azad. Hi there, sir. Can you hear me? I hope Mr. Azad is able to listen to me.
Yes.
Okay,
I can.
We really feel, sir, though this is a sad moment that you're joining us and you will be lending your perspective and insights with us here on Her World India Talk Show series. I go on to Vidyutma. Vidyutma, thank you so much. We've been talking earlier, and it was always my appeal to and request to you to join us to also lend your insights, experiences which you have wide, and a number of things that you've seen and experienced. So it's really, adds to this discussion today in the Her World India Talk Show series. Jatin, you are on the ground, you're seeing things firsthand. And we thought that it's very important that you bring to us those narratives that you are really watching as a frontline worker. And that's what we're saying today, that, journalists are frontline workers. When you're talking about any urgent measures that should be given to people of India, I think consider journalists as frontline workers, give them all the resources that they really urgently need, because they are the frontline people facing things, and they should be vaccinated. There should be medical attention which should be given to them when they need it badly. Nobody actually should also go away just because there is less resource and medical attention. Though we are, as an authority, as system, we are grappling with it. And that's where I want to go to Mr. Azad first and say, this is the second wave of COVID-19. And as the system would say, that there are unseen things which came before us, and it kind of struck us, shocked us. We didn't know how to react. How would you agree with that, sir, Mr. Azad?
No, I have a slight difference in appreciation of this second wave. When the crisis hit us, in fact, the first death, COVID death, took place last year on January 31st, if you recall. And thereafter, from February, the whole country was alerted that the COVID crisis has hit us. And thereafter, again and again, the epidemiologists, the doctors, etc., were warning us about the second wave. We were talking about the Spanish flu, we were talking about vaccinations, we were talking about a host of issues. And even last year itself, in March, April, about 10 or 11 empowered committees were set up under the various secretaries of Government of India to plan for the future. Mind you, the cornerstone of anti-COVID therapy, as per the WHO, has been ramping up oxygen capacity. And this was very, very well known. And therefore, there were committees which are supposed to create the infrastructure, the beds, and enhance the oxygen capacity, etc., etc. What I'm trying to say is that the second surge was expected. Like today, we are talking about the third surge and talking about the peaking to about 5 lakhs a day. If you recall, in September, we had about 93,000 cases a day. And thereafter, there was a miraculous kind of a recovery that we went down. And we had all the festivals. And there was a kind of a complacency which set in. And we realized that everything is about all right. And I think the biggest mistake we did again was to allow super spreaders like the Kumbh. We allowed elections to be held. In a national emergency of this kind, there was no need to hold them. So my contention is that in some ways, it is not something which has hit us unexpected. It was something which was about to hit us, but unfortunately, we were not really prepared for it.
Okay, so I go to Vidyotma. Vidyotma, at this stage, people would say that there's no point blaming, there's no point accusing, but we are all into it, so we have to look at it. But yes, just to look ahead, we have to look at where we stand and what we could have done. With your experience, Vidyotma, how would you really look at it in terms of our response system? How better we could have done, as compared to the situation we are in right now? As I and you are talking, we know that so many people are, not only grappling with their lives, but they are really, really battling it out in terms of looking for oxygen support, looking for urgent medicines. We know on social media, people are crying for help. How would you really look at it, Vidyotma?
Rakhi, I would like to take what Mr. Azad said further, because I agree with him completely. I think we have been callous, and not just in the second wave, we have been callous even in the first wave. In February 2020, it was the seriousness of the disease was brought to us by Mr. Rahul Gandhi. He was crying hoarse about it, and he was saying, why isn't the government listening? We failed at that time, but okay, despite whatever the steps that were taken, we became callous again. By November, December, when it was felt that, okay, we were doing something, we were doing better, we were exporting oxygen, we were exporting vaccine. I just want to bring one thing here, that whether we say we are into blame game or not, where does the buck stop? The buck stops with the government. And today I read on Twitter, you are active on it, all of us are, and we read that when the US said that it wasn't going to help us with the raw material and everybody was criticizing it, excuse me, US is putting its people first. What did we have to do? Why did we not put our people first? So these are the questions. And now I'll come to your, this thing. The very important thing for a government is, when it is telling everybody to mask up, not allow something like a Kumbh Mela, not allow something like election rallies. Here, the problem was that our Prime Minister and Home Minister themselves were the ones who were in the front of these rallies. And we saw them unmasked. We saw them touch children who were unmasked. Children were in the rallies. It gives a very bad example to the company, because they are extremely powerful and popular leaders. So what should they do now? Instead of, like what we say, कि रेत में सिर छुपा लेने वाली बातें जब खतरा सामने आता है, I don't think this is the time to do that. They have to lead from the front. The problem is they are not seen leading from the front. The problem is today, if you or I my sister is COVID positive, and I really don't know who to approach. If tomorrow she needs hospitalization or bed or oxygen, after being 30 years in media, I don't know who to approach. So this government needs to, the task force does not have to be in name. This government has to create a proper task force. Let's come to it. We all know that there are NGOs that have worldwide network. Since I belong to it, I know that when we eradicated polio from the world, it was the pledge that Rotarians had taken to eradicate by 2005. Today, there are only 2 nations in the world that have polio. We could have used that network, and the government uses that network all the time for polio. Why did we not make use of what we had? Why did we not think that, okay, our people would need oxygen, our people would need that? Why did we not put our people first, and at least today put them first? What are they doing? You tell me, Rakhi, you have been a journalist, Jatin is a journalist, Mr. Azad has been a police officer. Today, you tell me where. I just feel that we are all lost. We are all left to fend for ourselves. The government needs to create a proper task force. The government needs to create a sense of an atmosphere of confidence among the people that it's doing something. At least it should be seen to be doing something, not something like the UP government that is
Not being
filing
a
FIR cases for against people who are asking for help on social media. At least we are lucky that the Supreme Court, Mr. Chandrachud, today gave a very good ruling. He said that why can't people ask if the government is not able to help? I will come to a few other things later which have, sorry to use a bad language, rattled me about it, but maybe you would want to, take it further, and I will come back to that.
I must say here from the platform also, the idea is not really to at this point of time when we are all into it, to really put fingers at each other, but really trying to also understand the gaps and then work on it. So there are challenges which we know are very real, but we really want to also, we are also offering hand of support. We journalists are into it. We are helping people. We have created those chains of support, of solidarity. And that's where I now go to Jatin and ask him, Jatin, you have first-hand experience. I see you going, reporting every day, you coming back with stories, but what you're watching is also something which must have stunned you like it has so many of us. What are those experiences? I mean, somebody would say that what we are showing is little too out of proportion, but aren't we only showing the reality? Jatin.
Yes, ma'am. Am I audible? Am I audible?
Yeah, you are.
You said, ma'am, that, we're just showing the reality. The reality is that the numbers that we see in government reports, the numbers that we see in cremation reports, those are all just numbers. But all it takes is a visit to a hospital, and all it takes is a visit to a cremation ground or a burial ground, or basically a funeral venue, and you will see that the numbers that just seem constrained to some paper in front of you are actually there. Death is literally spilling out of cremation grounds. It's everywhere. Every second sound you hear is that of a siren, and it is more often an ambulance siren and not a police vehicle siren. That's how real it is. To cite an example, I've been associated with this profession for I think 12 years now. I started out in 2009 with the Hindustan Times, and my first assignment was as a crime reporter. So back in the day, I used to go to cremation grounds. I mean, I do remember the first few times that I had gone there, and those are experiences I still remember. But then after that, it sort of got routine for me. It became, I mean, the monotony gets you, and it becomes a routine affair for you, so you're used to it. The last time I went to a cremation ground was more or less after several years, last Saturday, and I couldn't sleep that night. I've reported on a lot of things. I've been to a lot of spots. I've covered murders. I've covered a lot of things, but the shock that I felt at seeing ambulance after ambulance lining up outside a CNG crematorium in Noida, the people wailing as they saw their relatives for the last time, because they couldn't even touch them. And they just saw them for the last time while their bodies were inside vehicles with their windows and doors tightly shut so that they could avoid infection. And and what it does to people. I mean, there are people who are not even ready to touch bodies of non-COVID patients because nobody trusts each other. This virus is so virulent, the fear is so palpable, and the dread is almost visible around us.
Yeah, I
So,
think
I mean,
some of these points that you touched upon are really need to be looked at. Like you talked about this whole lack of trust. This whole human element, which is sometimes all into a play, so to say. There are too many things that we need to talk about. But I now go to Mr. Azad. With your experience, sir, tell us. As a system, I mean, we are looking at, somebody said oxygen is there, but it is not reaching at the right time, at the right place. Hospitals are crying, they're putting up those notices because they need to also urgently tell everyone that there is a crisis. The patients, the relatives, they are all in, everything looks like in a disarray. Where are we really faltering? If we look at foreign countries, we have seen some of the examples where things were bad, worse, but how things were tackled also. How would you look at those very specific points? I mean, police has come forward. Police has sometimes, reached oxygen where it was needed. Police has helped. Police is out in the street. How would you really look at, this whole system coming together and creating a very solid, as even Vidyotma says, a response system, which is functioning and which is at its best?
See, there are two parts to it. One is the ramping up the infrastructure creation. That is the setup of infrastructure, whether it's like up oxygen capacity, for example. It can be done. There are 3 states, for example, Kerala, Odisha, and Chhattisgarh, who did a very good job. And today they are exporting oxygen to neighboring states. Odisha CM just did it the other day and was supplying it to Delhi, for that matter. Kerala was doing it to Goa. There is a young collector, a dashing young man in Nandurbar district, for example, who had the vision and the ability to look into the future of the second wave coming and put up 2 oxygen plants. And today he has put up a 3rd oxygen plant with the help of people's support. Now, what I would say is today the requirement, as you were saying, what should we do? The first thing is we should ramp up oxygen capacity. In 550 districts, the PM Care Fund is already providing the oxygen plants. They have come up with 700 more in some other places. Now, the other point is, why didn't the CEO, the chief executive officers of these great hospitals set up captive oxygen plants? Many of them don't want it because they don't want a space to be captured by it. But maybe it's time to make mandatory that the oxygen plant should be held. Secondly, it's a happy situation for us now that all the countries are sending oxygen concentrators and material for oxygen plants. So this is something which has to be properly planned in a way, because oxygen, even if you have plenty, the question of distribution, the question is of non-corrosive cylinders. Therefore, the question is of transporters, because those nitrogenous oxide containers which can be used. So for that, as Vidyotma was raising some very, very good points about the task force, about coordination, this is a very, very important part, number one. Number two is the question of beds, ventilators, etc., etc. One is the creation again of the numbers, and ventilators we are getting more and more. Our requirement is more, but again, it's a moot point of 2 things. For example, when we were setting up 133 plants or something, why did only 30 come up or 50 come up? What is the reason behind it? What are the glitches? This must be looked into now. Even ventilators, when we needed 1.5, why did we get only 50,000? So what I'm saying, whatever, the struggles we have, the roadblocks we have, it's time that we clear. Third, for example, why didn't we give permission for the Pfizer plant to be set up when they asked in 2020? We said, no, we'll be doing some more checks. Atmanirbhar is all right. But at a time like pandemic, at a time where you want to become the pharma manufacturer, why can't you boost up production? The third thing is, today what is very, very critical, and one of the speakers rightly mentioned, is how do you help the patients right now on ground? There has to be a robust management information system. There has to be a one-touch facility, and something like that is being experimented in Gurgaon, for example. by my friend Saikat Datta, where you get almost all the information. Today, as Vidyotma rightly said, catch hold of the NGOs. They have tremendous capacity, whether it's for polio vaccination, everything, they had help. Today, Niti Aayog is trying to take the help of these NGOs. I'm very, very happy. There are so many women's organizations, for example, I'm personally aware of and working with whom, that they can deliver all this. Therefore, and then, of course, there are other things you have to certainly look into. The center and state relations. Forget about the federal structure. Forget about the constitution. This is the time to borrow, beg, steal. If the state can directly get things from Bangkok, let them get it. If the center can do it and provide it, it's perfectly all right. Relax all rules, relax everything, and just go ahead with COVID management. That should be central plank. But in the meantime, stop all nonsense of these festivals. I'm happy Char Dham has been blocked, and all such things should be completely abrogated if they are even being attempted.
And I would like to reiterate and take your point more strongly and say, even urge the citizens, my fellow citizens also, that please avoid social gatherings or any crowd or any such grouping. It's not only the government's job to dictate you, but please think that it's very, very important, apart from masking, social distancing, and doing away from social gatherings of any kind. If you can avoid it, postpone it, please do that. It's very, very important. Vidyotma, we are talking about vaccination at this point of time and saying that, okay, mass vaccination drive would happen and then it would as if, really cure everyone of all kind of problems. How would you really look at this becoming a big solution?
See, vaccination will not be just a solution. There'll be quite a few other solutions, as we have been told. We will all have to admit that this has changed our life forever. It is not going away. We all know that, doctors have said it, and we all know it. It's going to remain with us just like the flu. So I believe we will have to go in for some lifestyle changes. Maybe mask will be there for another 2 to 3 years minimum. Social distancing will be there at least for 1.5 years. And I believe, I don't know how it will be taken, but I believe that the government, since we are not experts in it, I believe government, like the past governments, should invite all the past senior leaders of opposition, whichever party it is, who have ruled, who have experience, who have tackled such sort of crisis. Bring them together, because this is not about my government, my party. This is about my nation at the moment. Bring them all together. Take them into confidence. You cannot now run this nation by keeping secrets close to your chest. It will not happen. We are at the moment at crossroads. We don't know what will happen tomorrow. Invite all those leaders from different opposition parties, maybe from medical fields, experts. Create a proper, as Mr. Azad was saying, proper robust system. Create sub-levels. Create CEOs for each state. The central, the CEOs and all. Let the information reach out to people. Let people know that, okay, in this case, who is to be reached? What is happening? This is not the time, Rakhi, to hide information. I am sorry, I might sound very... anti this thing, but this is not the time to hide information. Let's be clear. Okay, guys, yes, we are at crossroads. We have faced difficulties. This is what your government is doing for you. This is what we have set up. This is the task force. These are the people. Bring it out in public domain. Tell them what you are doing. Tell them where you have allocated money. Let there be a clear transparency. And yes, the medical staff also, and the people will have to work in close coordination, because let's face it, yes, there are frontline warriors we have, but there are quite a few other reports also coming in. I will not delve into it, because yes, we should not blame anyone in this time.
Discussing things also to look at a road ahead, as we are saying. So I also want to go to Jatin and say, Jatin, you are covering Delhi government, and every day, we are looking at those numbers. Those who are in Delhi are really panicked because the cases really rose very fast and the numbers really kind of are startling. As compared to, let's say, when we began, we were looking at Maharashtra with a lot of concern, but Maharashtra seems, as the numbers would suggest, is doing a little relatively better. and the cases are coming down. How would you really look at, again, the Delhi government, doing things? I mean, somebody would say that, why at the last moment cry for medical needs? For example, the oxygen part, why not give the right kind of numbers? What happens to testing? Are they in the right kind of, at the right time? How would you really look at this chain of handling COVID as far as Delhi is concerned?
Well, suffice it to say, ma'am, that there are. I quickly like to say three things vis-a-vis timing: what they could have done, what they're doing now, and what they should. So very quickly, we are talking about a government which I believe sometime last month, if I'm right, or maybe even slightly before that, was thinking about downgrading the status of this of this disease to an endemic from a pandemic. There are on record statements which have been made by very senior representatives of the government, which are out in the public domain, which can be verified for this. Uh, there was a lot of stress which was laid, I believe, last year by all governments, which I think may have been because of the national lockdown to contain COVID, vis-a-vis testing people at least at transit points and especially at airports. I mean, if we are talking about the advent of new strains of this virus into the country, the airport has to be hello.
Yeah.
Yeah. Am I audible? Yes. So the airport, I was saying, if not the most, if not the only point where access was granted to these new variants to enter into the country, it was at least a very significant point. There was so there has been no action. I mean, it's also a matter of public record. There has been no action that was taken by the Delhi government at airports. I mean, if you're talking about identifying people coming from different parts of the country, I'm sorry. If you're talking about people coming from different parts of the world into the country, leave that aside. Even Maharashtra, as far as Maharashtra is concerned, I am not aware personally of the number of people who were checked at the Delhi airport while they were traveling from Maharashtra. What happened to those people? Whether they were placed under home quarantine, whether their contacts were traced, and whether testing happened, tracing and contact tracing and treatment happened aggressively, which was supposed to be the policy. That didn't happen. What is happening now in Delhi is that the health system is completely overwhelmed, if not completely in a state of collapse. Uh, every day, and I'm sure my fellow panelists as well as you, ma'am, must receive innumerable calls from people, from officials. I mean, it can be anybody. I mean, we are talking about being in a city where multiple governments. There's not just one government which runs this town. There are two governments over here: the center and the Delhi government. Now, whatever they keep doing among themselves, who administers Delhi, who's the boss,
Not
that's a
going
different
into
matter.
that, and not going into that. In fact, from three of you, I would really like to understand to begin with also, and I can go to Mr. Azad. We're talking about this whole hospital management also. I mean, we were all thinking, oh, there is a hospital. If I'm sick, I go to a hospital and I'm all right. Right now, what we are seeing is the whole aspect of management at the hospital level. How equipped hospitals are or not. Suddenly, we are now trying to analyze it. Suddenly hospitals, their own management, how much they can afford, equip themselves with, how much outside support do they need, all these things are being discussed. With your experience, sir, how would you really look at this hospital management, which is in place or which requires more attention?
Well, Jatin mentioned it absolutely right, that the whole system is overwhelmed. The kind of population we have, 2 crores something in Delhi, I mean, it is completely overwhelming the hospitals because they are not able to take the number of people. And the shortage is of what? Number one is of oxygen. Number two is ventilators. Number three is ICU beds. Number four is remdesivir and other applications like that. Now, the question is that with the ramping up of oxygen capacity and distribution both, we'll be able to fill it up, but it's going to take time. Secondly, the ventilators are being supplied. They will also take some time. The management of the hospital depends on first the manpower, the resource distribution, and the technical and the information system available with it. Right now, Rakhi, the biggest problem is that 95% of the people don't have to go to the hospitals, right? Only 5 or 6% really have to approach or whatever. But for those 95%, do we have an effective management information system where they can approach somebody on phone? Everyone has a mobile. Now we have retired doctors, we have retired NGO, just telling them that remdesivir is not required for the application is important. If your oxygen saturation capacity is 94 plus, you don't have to worry. But what is the initial stage of medicines which have to be taken? This can be done. Now, certain hospitals like Max, Ganganagar, Dangs, and all these are now having this home care thing. But that is for the rich people. They can afford. I don't know how much they pay. But many of the queries which I get, for example, these are from very ordinary people who cannot pay. Therefore, the system of MIS can be done. It's not very difficult. It's being done in places like Gurgaon. So I would say hospital management with bringing in a very, very robust MIS system, only then we'll be able to do it. So two things. One is the infrastructure support, which may come from outside, which may be ramped up now slowly. Secondly, increasing facilitation. And third, more and more better manpower resource, because we are losing, the COVID frontline workers. And in the end, a very, very robust management information system.
I
This
would
is
just
the need.
what you and I are all reading, and I'll also come to Vidyotma very soon, is that, but Mr. Azad, that, vote for your hospital. So basically, how much we really looked at the health infrastructure, how much more priority we should have given actually to look at how we're focusing on health as a very critical subject.
Excellent point, Rakhi. We barely, miserly give about 1.5% of our GDP to the health system. And the entire healthcare system takes about 3.5% of our GDP. Compared to the states like France, for example, even Brazil, for example, it's 10%. And that is why when you see in these movies there that, somebody is ill and immediately is taken to hospital, their hospital is not the last resort. Their hospital is for treating a system and improving the quality of life. It's not only for intervention. India has to think in terms of that. Today, we are getting into many, many needless subsidies, which can easily be cut. And that portion can be given to a health budget. And it begins right now. Today, we should ramp up health structure. For example, very simple thing. These IPL matches and BCCI is running into crores and crores. Let BCCI set up an hospital in where the franchise wins the IPL game. There are so many such instances like this where we can start right now and give permission to Pfizer's. Forget about this Aatmanirbhar right now. Today we have to get ahead through this pandemic, and as Vidyotma rightly says, it'll take a while. We don't know. It'll change our lifestyle. So for the next 1 or 2 years, when we are looking into it, we have to look ahead and think in terms of health structure. And last point, pandemic, medical emergency is also a part of national security, the robust health system. And Mr. Satish Chandra, I think when we had this SARS problem, there was a paper written on it, and a national paper on it. Then again, when there was swine flu, again that was referred to. We have to dig this out and again introduce this as a matter of health policy and as a matter of national policy instrument.
You're very absolutely right when you say that it's part of national security, and it is all very much integrated, and that's how we should look at it. Right now, what we're saying is a state of medical emergency. I mean, we are of course thankful to so many countries who have offered help, and the critical medical equipment and other support is coming from outside also, and there are so many countries which we know about are really reaching out to us. But with Vidyotma, somebody would also say, and let me, for the argument's sake, I will ask you that people have to also have faith. Sometimes they just think that going to hospital, asking for a bed and maybe oxygen or a medicine like remdesivir will generally cure them all. I mean, how as people also we need to be more, self-educated in terms of understanding things right.
That's a very brilliant question that you raised. When we talk of people on two levels, one is about going to hospital, one is what before going to hospital. So when everybody has been, and the government has done a very commendable job here, informing them about mask, about social distancing. I'll give you a personal example. There is in Mumbai, there is in Kandivali street called in Mahavir Nagar, there is a street that was, the moment the lockdown was open, and you could see that people standing on the streets on the food stalls, at the food stalls, there was no masking. There were 20 people at one food stall, 50 at another. And at times you saw that even during lockdowns. So when people themselves are not taking care and then they rush to hospital and say, Bhagwan, ke doctor, ab aap mujhe bacha lo, there is a limit to that. The other thing is, as Mr. Azad was saying, this is a pandemic that we never thought about. Our hospitals, yes, we did not give that much importance to our health system, but we also have to appreciate the fact that this was something unprecedented, and there will have to be some sort of patience, some sort of precaution for people to understand that it will not happen overnight. And as all the doctors, there are so many videos, though we disregard social media when it comes to the information system, we say don't believe it, but there are quite a few brilliant videos coming where doctors are telling people when is the need for them to rush to the hospital. So people have to follow that. It is not that I am tested positive and I ought to immediately rush to the hospital and I ought to be given preference. That is not the case. It does not happen like that. The other thing is, just imagine when we educated people are behaving like that. Think of the people, the have-nots in the rural areas, those living in slums. If we have not understood, just imagine what have they consumed of this information. This complete collapse, I still again say, use the network, spread the right information to the people in the slums. Mumbai is full of slums. We are talking about widespread in Mumbai, and I don't want to go into those details. Half of Mumbai is slums. Spread that information in other places. And yes, people will have to understand that, follow the guidelines that are being, I have seen videos of Dr. Devi Shetty of Gangaram Hospital and others saying, everybody doesn't have to rush to hospitals. And yes, our health system is collapsing, but then somewhere we will also need to extend support to the government. We might criticize the government a little later, but at the moment, we as people are supposed to stand next to the government, hand in hand, saying we'll beat it. That is not happening. Everybody is collapsing, and I'm sorry, I'll bring the role of media in it.
No, I think we're all into it. And I think the idea, ultimately, if we are having a discussion here, is not really to just, and that's not how it has been also from the platform, just to say that, okay, these things did not happen, the crying babies, but also saying that, okay, hey, what we can do ahead. And that's where, Jatin, I want to bring you in and ask you, there are a lot of misinformation, myths, rumors going on. You must be, listening to so much of hearsay, maine to ye dekha, maine to ye suna, kind of thing, and not really knowing what to do. This whole rush for medicines, the hoarding happening, black marketing happening. How are you really watching things? What are those experiences that you're watching? Which sometimes not only startle us, but we also are learning as to how to deal with them.
Ma'am, first of all, in reference to what Mr. Azad said about this being an issue related to national security, I completely agree. And I think we should begin by invoking the NSA against people who, on a daily basis, we see cases of people holding oxygen, people trying to fool each other, people trying to fool the public on, like just today, there was my colleague Saurabh Trivedi is reporting on a story about a couple of people who were caught, who were impersonating people from a particular lab, providing fake COVID reports to people. So people doing this, people dealing in black marketing of remdesivir, favipiravir, all these different medicines which are essential to the treatment of COVID. We should start by invoking NSA against them, firstly. And secondly, it's basically this. It is basically uh, uh, it's these resources which are very essential right now. Why can't we have the ESMA imposed right now? Why can't we have enforcement agencies going out proactively and ensuring that people get, even after these cases come to light, if they confiscate medicines which are being sold at a higher price, which are being black marketed. I know of instances where my colleagues who cover the police have told me that the cops are fighting an uphill battle from courts to get even vials of vaccine which they've gotten from criminals, medicine, and all these other resources, getting them out of courts, getting them out from the malkhanas of police stations, so that they can be actually distributed to the people who need them. So this there's a panic. There's absolutely a panic, and I don't think chief ministers and senior government officials going to town and coming to social media saying that they're out of oxygen, and in effect creating a panic. I've personally spoken to people, for example, who were providing services related to oxygen in the city, both from NGOs as well as people who were into industrial oxygen supply. They've told me stories about how people are just coming into their homes, they're walking into their shops, despite them being industrial oxygen suppliers. They're touching their feet. They're ready to do anything, willing to pay any price to get oxygen supply. Why? Because there's suddenly a panic in the market. There is this people citizens believe that oxygen that everybody should have an oxygen cylinder at home. Why weren't we doing this the entirety of last year? Even the lockdown that happened, and even if there is a lockdown, which, I mean, perhaps we're getting there, maybe it'll happen, maybe it won't. But apart from breaking the chain of infection last year, the entire intent of the COVID lockdown was to ensure that hospital and medical capacity was ramped up. Here, in this situation, at least in Delhi, when thrice the number of cases, which compared to the peak of July, August, or June, August last year, we're getting thrice the number of cases, and still stadia, open grounds, all of these arrangements which were in place last year, there's no talk about it even now. I mean, hotels have been attached and all of that, but all that takes is an order. But the actual feat of going to the ground, uh, we are now hearing the Delhi government saying that now we've identified two Ramlila Maidans, one in East Delhi, one in Central Delhi,
Oh,
to make facilities. We and by the way, hospital beds, normal hospital beds, are in supply. They are very few and far in between, but they are there. What we need right now is oxygen supply. I mean, even the Commonwealth Games village facility, the COVID care center created there, I have reason to believe has run out of oxygen. They're
these are
telling people to bring
very, very good inputs, and coming from you where you're handling things every day and reporting, I think these are the things that really should go out, and that's what we are also trying to do. In fact, one of the things, Mr. Azad, that I would really like to put here is that, when people hear the word lockdown, everybody gets scared and they think, oh, lockdown is something which is about restrictions. I mean, tell us, for the benefit of our viewers and people who are watching us, is that why a lockdown becomes essential?
See, first, Raki, there's a difference between lockdown and curfew, right? Curfew is, installed, for example, when, there's a communal disturbance, there's a national war, or, there's a bombing going on. Lockdown is in a positive way to save people's lives. And that's why you'll also see that the lockdown this time has not been very brutally observed. For example, when people are showing their passes, saying hame ye karna hai ya ye kaam hai, then they are being allowed. For example, you can't have passes for everything. Lockdown is for the safety of people. It's a positive measure which is being put. The negative part of lockdown is only one, that it affects the economy, it affects the daily wages, it affects the migrants, and it affects those people who have to commute every day, those poor people, for their daily bread earnings. So that is the difference where lockdown. So lockdown should not be seen in a very, very negative way कि नहीं ये तो हमें परेशान करने के लिए लगाया गया है. But today the need is containment of the zones. So lockdown, if you see in that respect, there are two views about it. One view is that you should not have a general lockdown, but you should have specific restrictions on the containment zones. And therefore, those districts which are spreading like hell, which have very, very high danger rate, they are the ones should be where the lockdown should be introduced, where containment should be done, and the others should be left free, but with discipline being enforced. So that is really the main issue we have to look into.
Another question, of course, I want to ask you here is that, talking about regulation, talking about the administrative measures, we have seen police going out and all kinds of videos are coming in. We saw one DM in Tripura and how, he behaved. Then we start asking that why the police or why the authorities behave like this, why people can't cooperate, things like that. How equipped you think the force, the police force or the security force is able to handle such situations? I mean, they were always trained to handle situations of security, or for different kinds. Somebody would say, are they really trained to look at these things? What would your experience, how would you look at it with your experience?
Well, let me tell you, in distressing times, two things come out. One is the best face of humanity, and one is the worst face of humanity, the other side. So that is why even during a pandemic, you will see hoarding. And even in pandemic, you will see a person from Bokaro buying a 10,000 rupees cylinder and coming 1,400 kilometers all the way to help of his friend in Noida. So these are the two parts. The police is the same. It's a part of the society. Police is providing the green corridors today. Police is helping in cremation. Police is helping in supplying beds. Police is helping in reaching people to the hospitals. But there are instances also where police is using a heavy hand. These are different kinds of people. About Tripura, I don't even want to mention, I'm so pained. कहते हैं कि कुछ ओहदे सही नहीं बैठते हैं कुछ लोगों पर. इसे डिस्ट्रिक्ट मैजिस्ट्रेट किसने बनाया, I don't know. Because I think he deserves a taste of his own medicine. You see the example of a district magistrate in Nandarbar who's making oxygen plants, and here is the instance of a district magistrate who's pulling the by collar and abusing the mother of the bridegroom. What do? This is India for you. But what I'm trying to say is that there is definitely, see, there are authorities, NDMA, National Disaster Management Act, we have the Crisis Emergency Force, we also have the NDRF, which is doing an excellent job. Police can be the first responder, but you can't, realistically, you can't really police to be trained in everything. They are putting barricades, they are stopping people are not listening also. And that is the biggest problem, as which Vidyotma was mentioning, that people just don't listen. I'm surprised the high courts have come down very heavily on the election commission. Election commission cannot do anything to enforce anything at the rallies. Do you think it is practical? That is why I'm saying you have to have a central election commissioner who's bold enough to say no elections can be allowed in national emergency, because you cannot enforce anything in a system like that. So that is why we have to go by a system where we have to promote this kind of a discipline, enforce whatever we can. And one thing I totally agree with Jatin when he says that these hoarders, these people who are not allowing medicine to go to the right people, not allowing oxygen to come out, they should definitely be held under the ESMA, NSA, and other things. This is time to get into that and enforce it very, very ruthlessly.
No, in fact, salute to people like Jatin and many of his colleagues, who are both male and female, who are right now at it. They are covering, stories every day, bringing it to us. And I think what a great job they are doing, because if they don't bring those stories, how much of reality we'll fail to even understand. So thank you, Jatin, and many of you who are actually doing it. Vidyotma, coming to you, we are talking about this whole robust system that we need to create. Why don't you think learning from other countries and how they really looked at each point, each gap, and then worked on it, and then tried to overcome the crisis? This whole trust deficit we see sometimes, why don't we really look at state citizen partnership, and then go ahead working together collectively?
I think, Rakhi, our priorities are very different. Our priorities are not our people. Our priorities are votes. I'm sorry, I'm going to be extremely blunt. Our priorities should have been our people. As Jatin was raising a point, what did we do in the last 1 year? If we did not do anything in the last 1 year, what are we doing now? So this trust deficit will happen because we have not actually created any infrastructure or an information system for our people. Now, before I go to what you said, there are 3 points I want to raise. We are at the moment looking at COVID. Let us brace ourselves for mental illnesses. They will hit us bad. People are locked in houses. Women are facing domestic abuse that has hit the roof. And even when people, at least, every family is not a perfect family. We are not looking at it. It'll come out in the open very fast. Now, when people went out, there was an escape system for working women, for men, for families. Today, some of us have the luxury of having good enough homes. Those who are living in a 10 by 10 house, they are 7, 8 people living together. Let us brace ourselves. Let the government start thinking on those lines now. Of course, COVID has to be beaten. Domestic abuse, we have to look at something. We have to do something. That is the reason why we need to create, as Mr. Azad has been saying, that complete infrastructure and information system is so important. And Rakhi, I want to raise one point over here. With no offense to anyone, yes, the medical staff is a frontline warrior. There are too many other frontline warriors which we haven't thought of. Media. Every day we are hearing of, I'm sorry I'm going out of what you asked me, but every day we are hearing of a journalist or a photojournalist succumbing to COVID. We have not even thought of the bankers. How are we running for the last 1.5 years? All these bankers are, my niece is into banking and she travels 20 kilometers a day since the last 1.5 years every day. What are we doing for them? I feel that a government has to be proactive and think on these lines and start working on various fronts. The problem is we have created such a trust deficit because our priorities, as I said before, are not people. Let us, at least now that it has hit us so badly, let us prioritize. What do we need to do? We need to safeguard our people. We need to safeguard our people. For how? These are the different factors. What we need to do, we create one central task force, different task forces for these people. How do these people work? That complete chart has to be made and it has to be implemented. And we will never have that trust if our government is not open with us, whether you call it the system or the government or whatever. We will not have that trust, as Mr. Azad was saying, if the election commission does not have a spine. We will not have that trust even if certain media people do not have that spine. I'm sorry, but even certain media people have not been bringing the truth. They are only either creating panic or giving you fudged up figures that have been doled down to them. So it is not just one or two people, not just the government. We all are to be blamed. We all are in the system. We all have to, when we're talking of ramp up, we all have to change ourselves.
So look at some of the positive points. Let me also bring those in. Is that, for example, if you look at Tata, initially when we were really hunting for oxygen, crying for it, it immediately looked at, some of the industrial plants were shut and immediately oxygen was diverted. So some of the companies started to do that. Look at even, Serum Institute. So look at Aadhar Poonawalla is young. It was already doing things, but it has now come in. I mean, whichever way we want to look at it, but you have examples where people have stood up. You have so many examples of sudden heroes, heroines, warriors coming in who are rising up to the occasion. and we must recognize and salute. I would say at this hour, when we are talking, this Char Dham Yatra, which we really got panicked when we read about it, has been postponed. I mean, some realization which should have come earlier, of course, it's coming in at this stage, जो कि थोड़ी देर हमें लग रही है, delay लग रही है, but ये अब जाकर आई है. So people, young people, we are a young nation. So many young people are at work. We are seeing every day on social media, so much of help coming in. People are even helping strangers. Somebody just writing in a name and crying for help, and somebody just gets in and says, okay, I'm doing this for you. I'm going to do your home job. I'm going to bring grocery for you and things like that. So we've also seen the human spirit actually coming up. Mr. Azad, you'd also agree with that. A point of, new engagements, the road ahead. How do we still stick to those chains and say, now we are going ahead, let's all do this together, Mr. Azad?
First, let me say that I'm a strong believer in that humanity triumphs all perils and disaster. We have gone through the worst, but now the government is trying to put it back together. It's a very positive sign. The oxygen plants are coming up. Tatas are diverting for the use. Facilitation is being there. Ramping up of beds and capacities is being done in Delhi. The vaccination program has to be promoted. That's number one. And I'm sure, I believe Kejriwal, when he says within 3 months, he will do it for all the people above 18. We have to keep in mind a very, very sensitive point which Vidyotma brought about, and I'm very happy, sensitizing about mental illness, sensitizing about domestic abuse. These can be looked at. And also the frontline COVID workers, from bankers to other people. I think that's a very, very sensitive thing which can looked into, and that is the road ahead. That health expenditure again has to be expanded. And I'm sure that within a month or so, we'll be on road ahead. But it will be a very, very painful recovery. जैसे कहते हैं ना, एक आग का दरिया है और डूबते जाना है. So, but we have to suffer before we reach there.
True, and I would also add to that the scientific temperament, the inherent scientific understanding that India always boasted about, India always has been proud of, whether in Ayurveda or whether in mathematics or our own, earlier scientific methods that we always believed in terms of scriptures and all. I think we have to now put it in practice and really, trust our scientific people, the body of scientists, and how we are looking at innovations. Startups which are innovating, which are bringing up new ideas. Jatin, to you now, we are talking about, again, children, women, and as both Vidyotma and Mr. Azad said, and of course at Herbal India, we are so concerned. How are you looking at, some of these women-headed houses? Sometimes you see a patient, suddenly, leaves this world, goes away, then there are only women left. So how women do you think are really tackling, this crisis, and how are you looking at some of the girls and women facing it all? Of course, we are talking about domestic abuse, violence happening. NCW has just now at this stage created an app and saying that we will try and help women. Women have problems of their menstrual hygiene and how to really look at that. Sometimes all kinds of problems related to the crisis comes up, mostly for women. How would you look at it, Jatin?
Starting from something as basic and as essential as the household maid, who is denied entry when there is a curfew. When even last year, when there was a lot of talk about how RWAs had become tyrannical and become dictatorish almost overnight after or during the lockdown. Even now, when the curfew happens, we just call it by another name, but a lockdown by the name of a curfew is still a lockdown. But even these small lockdowns have triggered anxiety in households where these domestic workers are supposed to come, as well as in their homes. They fear for their livelihoods. They fear whether they'll be allowed. And everybody knows of instances where employers haven't paid full salaries to their staff. Even when we talk about our medical personnel, ASHA Asha workers are at the forefront of any government's bid to tackle this, whether it's through vaccination, whether even during the lockdown in Delhi. I mean, since that's my area of operation, I know of so many people of Asha workers who led from the front, who were part of district surveillance teams, who were visiting homes, not caring about their own health and well-being, and many of them just used to stay back at hospitals or at government facilities because they didn't want to go back and infect their family members because they were out in the open infection. So that is an issue. But I think we need to one thing I think which kind of can be seen as the way forward in this is a very encouraging tweet that I saw from DCP DCP for Women's Security in Noida. I will just dig up her name. But she today on Twitter has sought help from the public at large to basically volunteer to help children and help families who have lost either both of their members, who are basically people who have died because of COVID, or people who have contracted it and need help. So I think that is something that needs to be emulated by other. Brinda Shukla IPS. She is DCP
Noida,
Women's Safety in Noida. She has today in the morning tweeted looking for volunteers to help such families, help and especially children in those families. So there we are. There are women who are facing the brunt of this, whether it is medically through infection or economically through the costs of the curfew. And then there are also women who are leading from the front and trying to address this issue. So that I think is something to be emulated by other states, other forces.
I think more understanding from men like you, whether at work, for example. I saw this female reporter facing the wrath of some of the relatives who were saying that, what are you asking us for, because you've also failed. So sometimes when journalists go and cover the reports, they also have to face some of these unpleasant things that people think that you've also not done much, and all the wrath actually comes down to them. That also happens, and I can really only empathize and also, of course, give my shoulder to show such courage in these times of crisis to all those men and women out there. Mr. Azad, one as we're trying to also wrap up, but one of the questions now that vaccination registrations are happening, how is it going to be? We are hearing all kinds of things, when it will really come into force in terms of a lot of people getting vaccinated. What would you say?
Well, yesterday there was a problem about the portal because 1 crore registered in some time and it just went down. The problem is that many states have said that they don't have the vaccine, so they cannot do it. In fact, the Delhi CM has already said that not to crowd the centers. Jatin would know even better. Not to crowd the centers on the 1st of May because there are no vaccinations available. Now the question is, we already know the capacity production 7 crores and 2 crores per month, and we have vaccinated about 15 crores. We have now included 90 crore people to be vaccinated, all above 18. So there could be a possibility of only limiting it, lowering our standards and keeping it from 25 plus, so that at least there is one segment which is safely kept in the net, and while the others can be wait for a while. So these are ways we can do it. The Sputnik is arriving in May, and we should just go in, allow the states to buy Pfizer, Moderna, whatever you can, because unless we ramp up vaccination, there is no solution. This problem will remain. We have to fight it very hard. One, by ramping up vaccination, and secondly, improving our healthcare management.
Okay, so now to Vidyotma, I mean, in terms of points that we are picking up, Vidyotma, what would you pick up? The crisis that we saw last year and now. Of course, I have to say this, that we, of course, were caught off guard. We were celebrating Diwali and all the other festivals in between. Maybe some of us also did not really see it coming like the manner it has. What points would you pick up at this stage, Vidyotma?
What I think is, let's be patient. The first thing is that we have reached a stage where it is at least 60% of fatality is handled. That is one. When it comes to vaccine, let us also be patient, because the government can do only this much and not beyond it. We have faced 1 year. Let us have another 6 months. Let us give that much time to the government to ramp up. And those who are actually in need, when we talk of 18 years, those who are suffering from diseases, let the government create that structure for them, that those who are suffering from diseases like they had done for the elderly, they get vaccinated first and the healthy ones get vaccinated later. There are certain criteria that I think if the government decides, that could be done. I am an incurable optimist, and I'm sure we will all beat it. The only thing is to put our heads together and just help each other. We were talking about the servants, if I can raise a point. And Jatin had raised this beautifully about the helps that come to our homes. I think let people have the heart and understand that it is not their doing. If they are cooking themselves or they are working at homes themselves, give them their full salaries. We have, for the last 1 year, traveled ourselves to give those salaries to those people, because we know that they cannot walk, they will not be allowed to move out. We can do that much as humanity. I believe at the moment, the most important thing is let the scientific and government heads put together and create that infrastructure. We as human beings, let us also start spreading positivity, and let us also start extending a helping hand.
That's very right. I mean, yes, but are there any questions? I'm just asking my team if there are any questions. You can also go ahead and ask those questions. So many of, I think some of you had wanted to ask some questions. Are there questions coming in? If they're not, then you can always write in to ask, because every day. Otherwise, Her World India was hosting this show every Saturday, but in these times we thought of starting it almost every day, so that we can take up many voices. We are also talking to doctors. We're talking to different kinds of stakeholders, experts, so that we can only try and become a bridge between, as we are saying here also, creating the right kind of information platforms, so to say. And that is what we are doing. If you have any question right now, that's fine. If you don't have, then you can always write into us. These experts have very, very brilliantly put forward their views. And I think so many of these insights are really, really going to help us as we take them home after the show as well. Let me wait for some time if there are questions. Otherwise, we'll have to wrap it up. But in future also, Vidyutma, Mr. Azad and Jatin, we will be in touch. We'll stay connected. We are watching things on social media. We are all actually are there. But otherwise also, whatever is happening around, let us also offer whatever, in whichever way that we can support, offer shoulders. And from Her World India, we really wish the same. Miranda House College, let me inform, has started a COVID desk, and we are also in touch with doctors so that we can help many young girls also, as many as women who are also talking to us, and whichever way we can offer them some solace, some support, we are doing. Any question here? If not, then that's what I was told. Vidyutma, are there any of your friends who want to ask questions?
No, they have just left. They were here till now. I believe they've just left.
Okay, so thank you so much to those people who are here then. And we can always, either in a separate show edition or through their writing, we can pick up this question. So thank you, Vidyutma, Mr. Azad, and Jatin once again. Thank you so very much for joining us today. Thank you.